Well, good afternoon, everyone. Good afternoon. So it has been 5 months since I declared an ongoing state of emergency here in the city of Richmond in response to the COVID-19 pandemic. The city of Richmond is currently in phase 3 of Ford, Virginia, the governor's plan for reopening. And if you have any questions about what that means and for the businesses that you patronize, please visit rvastrong.org/reopening guidance, rvastrong/reopening guidance. City government offices and facilities are also in phase 3 of operations as well, and you can learn more about how to safely receive services from your government at richmondgov.com/COVID-19. richmondgov.com/COVID-19. There you can find an updated list of operations at its current time. And as of this morning, the Richmond City Health District is reporting 3,455 positive cases of COVID-19 in the city over the last 5 months. There have been 60 total positive cases in the city of Richmond's workforce, those who work for the city of Richmond, and 43 Richmond residents have perished because of this disease. With that, I'd like to observe a moment of silence for all those who have been lost within this pandemic. Thank you. As you all know, the Health District still offers free community testing every week. We have events this week, Thursday, August 20th at Fairfield Middle School from 9 a.m. to 11 a.m. We have Saturday, August 22nd at Richmond Ephesus Seventh-day Adventist Church. Remember, these events are available to the broad public, regardless of insurance, citizen status, mobility, or geographic location. And if it would make you or your family or your coworkers feel just a little bit more comfortable, we should suggest that you go ahead and get tested. And if you're unsure of your testing options, we request that you visit rvastrong.org/testing. Please pass it on. Test, test, test. You can also call the hotline 804-205-3501. And with that, I ask Dr. Avula to come up and please provide a report from the Health District. Dr. Avula.
All right, thank you, Mayor Stoney, and good afternoon, everybody. The trending on COVID-19 data I have shared, as we have most weeks that I've been up here, has been somewhat all over the map over the last month and a half. Over the last 2 weeks, we had a sustained increase in daily case counts here in Richmond. The median daily case count had been about 24 cases a day. That has dropped to 18 cases a day in this past week. Percent positivity has followed suit. We've gone from 8.8% positivity at this time last week to 6.9% over the last 7 days. So it does look like trends, at least this week, are moving in that direction. Hospitalizations in the central region following the same downward trend. Will it be sustained is always the question, and ultimately it is up to all of us to ensure that it is. I had a very personal reminder of just how challenging it has been and will continue to be until this gets solved. I developed a little bit of congestion over this past weekend and was just racked with all of these daily decisions about, do I go out, do I go to work, do I isolate from my family, and having to recognize even a mild symptom and how much that will impact your life until you get a test. And I did, and thankfully it was negative, which is why I'm here today. But it's a really important thing for all of us to recognize that we need to be paying attention to those symptoms. We need to be changing our decision making if we have the development of any of those symptoms, and we need to go get tested. one of the big headlines nationally this past week was the CDC was reporting a sustained increase over the entirety of this pandemic in childhood cases. From March to July, they just saw an increase in the rate of children who were impacted by COVID. That has not been our local experience or the experience of the state of Virginia. Our 0 to 9 cases hover a little bit below 4% overall, and then our 10 to 19 cases around 7.5%. But there are a lot of different potential reasons for that. Remember that kids don't show symptoms as readily. Remember that when you're asymptomatic, families are often less motivated or even think to go get their kid tested. And so last week, the governor announced there will be a new seroprevalence study looking for with kids in Northern Virginia. And a seroprevalence study is where they look for the presence of antibody to tell whether kids have actually been infected by COVID-19 at any point. And so that will give us a little bit more information about what the landscape around kids looks like here in Virginia. I think all of this, especially as we head into the winter months and expect more circulating viral illness, points to the need for a continued focus on testing. The state is doing a great job of trying to add different tools to the testing toolbox. We heard about antigen testing. Just this past weekend, a lab out of Yale got approved for saliva testing, saliva PCR testing. And so that hopefully will come to Virginia sometime soon and give us even more options for testing our population and getting rapid results. Because, as I continue to consult on a daily basis with offices and schools and institutions, the contact work around this, how do we contain this disease, is so dependent on availability of testing and a rapid response. The last thing I'll say is about the role of cleaning. So we, at the beginning of this pandemic, there was a large focus on environmental cleaning. Often we would see a case, see a cluster of cases, we would shut down offices, people would not return to that space for 48 hours until they went through a deep clean. Now, there are still clear CDC guidelines around the value of contact surface screening, but the enormity of the research, the data is showing us that contact fomite spread is not a major driver of disease. And so we do need to respond to that data to change our practice, and that should find its way into what our societal expectations are. When somebody tests positive in a congregate setting, there really is no need, if there's been a regular cleaning schedule, there's no need to shut things down, there's no need to do a deep clean, but really regular, frequent surface disinfection is all that's needed to minimize the spread of transmission through that medium. Thank you.
Thank you, Dr. Avula. Thank you, Dr. Avula, for the update. And I'm going to add one thing as well. I know that we have students at Virginia Commonwealth University who've returned to the city of Richmond, obviously. And Dr. Avula and I have had conversations about this, us keeping an eye on cases, any confirmed cases that may come out of them returning to the city of Richmond. Obviously, we want them to adhere to the same guidelines and protocols that have been provided by the CDC. That means watch your gatherings, to continue to wash your hands, be thorough about that, to continue to wear a mask as well. We've seen a number of universities around the country who have had to take a step back because of the arrival of students into their communities. And obviously we are cognizant of the fact that this could mean more transmission in our city. And so we need your help. If you're a student at VCU, we ask that you follow those protocols as well as every resident in the city of Richmond has. I think that has been the main reason, Dr. Avula, we've been able to keep the virus at bay as much as possible, but we still must be vigilant. So that is my request to my friends at VCU. At this time, I'm going to ask the Richmond City ambassadors to come join me up here. These ambassadors are ambassadors into our community. They go into many of our neighborhoods to outreach to the public and our constituents about what's going on in the city of Richmond. Yesterday, we were at in the Mosby community, actually, and we walk the neighborhood there together, providing information about job training, things of that nature, and I appreciate you all being here with me today. As you know, the upcoming school year will be entirely virtual for Richmond Public Schools. This decision was made with the interests of families and children in mind, and I fully stand behind that. We want to make sure that public safety and public health are of utmost priority for this administration. However, though, K through 12 education is still virtual. Many caregivers are expected to go back to work. They still have to go back to work to pay the bills and put food on the table and keep a roof over their families' heads. And this creates a need for affordable, quality health care options. So my administration, alongside RPS and the city's nonprofit partners, has been working to meet the need, whatever that may look like in our city. We have bus drivers who keep our transit system running. I think they deserve affordable care options for their kids while they're providing a vital public service. As restaurants and salons and gyms open back up, employees will return to work, and their kids deserve quality care when mom or dad are out working. And of course, our own teachers, responsible for executing unprecedented virtual learning, deserve quality care for their kids, and their students deserve their undivided attention. And this is why I sent a letter to the RPS school board on Monday to request the availability of school facilities so that we can create an important public option for childcare, should that be something our community desires. Our neighbors in Chesterfield and in Henrico have already gone this route and are actively enrolling children in advance of the start of the school year. I've set aside $3 million in CARES Act funding for this sort of emergency child care. But we just can't throw money at a problem. We refuse to do that. We need to listen first. We need to evaluate the need. So we're asking caregivers, do you need help? Ideally, what would that help look like for you and your family? Here's the link to the survey. It's bit.ly/RVA family. We're working to make sure the survey that you can access right here is reflective of the entire community. So here's how. The survey is available in Spanish. Our network of nonprofit partners, including out-of-school time providers and the Emergency Child Care Task Force, will be promoting the survey, ensuring families have the chance to tell us what exactly they need. And of course, our team of community wealth building ambassadors will be knocking on doors, making calls into underserved areas with unique needs. And as they have for 3 years now, they'll be doing that for our community. The ambassadors have placed nearly 40,000 flyers during the pandemic, spreading vital info to the communities that need us the most. And I trust them to get the word out about this survey as well. So, if you have a child in the city of Richmond, I ask that you take this survey. Tell us what this fall is looking like for you so we can design a solution that fits your needs and the city's needs as well. And before I take some questions, I want to say I was in the Mosby court community yesterday, and the folks up here can vouch as well, that we asked a number of families and caregivers about their needs for this upcoming academic year. And I do recall a couple of anecdotes where parents said, well, I got to worry about how am I going to get to work, and also make sure my kids get a quality education virtually at home at the same time. So they do need a caregiver. So am I going to have to find a job where I have to work in the evening after they're done with their virtual learning? These are all the sort of issues that are being tackled right now by families. I think about myself, and if my grandmother was not in my life, and my father who worked most of the day, sometimes during the summer times, hours would change from 8 to 5 or 6 o'clock, or 3 to 11. Where would the caregiving, who would be home to care for us, or where would the options be? There are a lot of families right now who are facing those same options. We obviously believe that public safety and public health have to be of utmost priority, but we also know that a lot of our families are facing some challenges, some hardships that I think that city government has a role to play. And so that's why we want to listen to our community. So with that, we'll take some questions. Thank you, guys. Sure, I'm going to have Dr. Avila take the first question, and then I'll come back up and help with respond to your second question. And Dr. Avila, if you could repeat the question, that'd be great as well.
Henry, the question was just to comment on the fact that at this point about 80% of the cases in the city are in African American and Latinx residents. So is there anything else?
What should we read into that?
Yeah, sure. Sure. Yeah, we've talked about from the beginning of this pandemic the disproportionate impact on low-income families and communities of color, and obviously those communities overlap a lot because of our structural inequities. So the good news is that we've seen some pretty steadily decreasing rates in our Hispanic Latino community. They really peaked in May, but have steadily decreased since then. The bad news is that our case percentage and our case counts have seen the opposite trend in our African American community. Now, when we start to break that down by age demographics, what we see is that the spread is largely in that 20 to 40 age range, which I think points to the reality that younger people throughout this have maybe felt like COVID is not going to impact them as directly. What's good news is that our hospitalization rates continue to decrease. Our death rates are definitely on a downward trend. We see fewer and further between deaths, which mean that our most vulnerable populations are steering clear of infection. So I'm not saying that it's not concerning. We absolutely want communities to continue to, wear masks, wash hands, keep distance, and be mindful of their symptoms, because those are the core things that are going to stem the spread of disease. And I think that hopefully is heard in a new way for residents throughout our city as they see that, African Americans 20 to 40 are the group that are growing with COVID cases the fastest.
Henry, your other question was about the letter that we received or was sent to the Commonwealth's attorney yesterday evening, I believe. And you may have heard the story before about how we went about removing these racist Confederate monuments and symbols here in the city of Richmond. And after the injury that occurred in Portsmouth, we knew that it was urgent, that it was an emergency here in the city of Richmond as well, and to start considering removal of those monuments as soon as possible. So my team, I got Bob Stodell here, who's the Deputy Chief Administrative Officer for all things operations. My team started reaching out to a number of firms, several firms in the region, to seek their help in this removal process. I was not involved in any of those talks or that outreach. I was only informed later, after they were able to secure the services of Team Henry, about the selection of that contractor. Team Henry was the only one that was willing to take on the personal risk. Now, personal risk is real, right? That is why Mr. Henry, Devon Henry, chose to shield his name and the name of his company in the creation of NA LLC. It's some serious personal risk that you put yourself out there in the removal of these racist symbols. And the things that people are willing to do to protect granite and bronze is unbelievable. Unbelievable. So I support Mr. Henry and what he did to protect not only himself, but also to protect the safety of his family and of his employees and staff as well. We've seen in other cities contractors having their cars essentially firebombed and faced with threats, and I can take it. You know, I signed up, I raised my hand to take an oath to lead this city 4 years ago, 3 3/4 years ago now. What I can't take is the sort of threats, the vitriol that is faced by contractors who are doing what I think is heroic work, putting themselves at risk, or members of my team as well. What is lost in this, and we should not be surprised, but after reaching out to several firms, that the only firm that stood up and raised their hand was a black-owned firm right here in Richmond. Should we be surprised? No, we shouldn't be surprised. Because Mr. Henry knew that the right thing to do was to step up when his community needed him. He loves this city, and that's why he was willing to take the risk. But no one should risk putting their family in danger. So I support the way he went about shielding his team and his family from that sort of vitriol. My team receives this vitriol almost daily now since July 1, prior to July 1. I can take it, whether it's on social media, phone calls, threats via the mail, I can take that. But should the young black man who attends to the phones at my office have to deal with that? No. No. I'm sorry, ladies and gentlemen, this hate is real. It might be 2020, but some people still have an 1820 mindset. And I think that's what's missing in all this. This is a real human being with family. If you've seen the stories of what happened in New Orleans and other places, you think twice about letting folks know where you live, would you put your head down at night. So I'm proud of the work we did alongside Team Henry. It was heroic work. Heroic work. And it's my hope that he can stay safe and protected during these difficult times.
What can you say to people that might believe that you chose Mr. Henry because he contributed to your campaign and perhaps you allowed his name to be shielded for that reason? Can you respond directly to those folks?
The question was, what do I think about those who think that the contract was received by Mr. Henry because he was a contributor or supporter of my past campaign, and that's why I allowed for him to be shielded. As I stated earlier, I don't get involved in the procurement process, ever. That has been the practice of this administration, practice of my office from day one, and it was the practice that was followed through in the right fashion for this particular contract. I didn't know who NA LLC was until after the selection of the contractor. But as I stated earlier, I see why he would do that, and I support him in doing so. The hate and the vitriol that has been poured down on my staff and my team for doing something that's right, those statues cast a dark shadow on this city for a very, very long time. And when you remove those shadows, you're disturbing something as well. I recognize that. And we have been the target of that. We have been the target of that. Actually, you know, if you want to know why someone would want to shield their identity, I'll play you something. And you tell me whether or not you would shield yourself from this sort of vitriol. Bear with me.
A message received July 30th at 10:29 a.m.
Yeah, I just read a thing here about the mayor there was going to put a slave museum and monuments down in Shockoe Bottom. Let me tell you something. You did not protect the monuments that were there. My name is Staples Mill Road. Yeah, you might have heard of that. I've been around that city since before, my family has before the Civil War. So let me explain something to you. You're a racist piece of shit. So is your whole party. You're a member of the racist party. And if this goes up, you have not seen the destruction like you have seen so far. Because we will march into there and tear that son of a bitch to pieces. You hear me? We're not going to put up with your racist bullshit. Yeah, you went to Tab High School. Big deal. You went to a bullshit high school, too. But you're a moron, dude. You're a racist. You believe in that black lives matter. All lives matter. 14% of this country is black, and y'all think that you're going to run the whole country and turn it over and make white people your slaves now? You have lost your cotton-picking mind, son. You're nothing but a racist. You hear me? You're a racist, boy. That's all you are. Blacks are racist, and you're the biggest. I got a lot of black friends, and you're the biggest racist that I've ever seen in a black person, and I've run across many of them in my 66 years. You're a piece of shit, dude.
Received July 30th at
Daily. In 2020. It just makes me mad. It makes me emotional. So when people think that this is about a contract or anything of the sort, this is not about any of those things. That is just about shielding from what this is really about. And you heard exactly what this is about.
And to challenge that just a little bit, Kim Gray, who's sent this letter to the Commonwealth's attorney, she is a black woman. So I'm not sure if her intentions are racist, because that's what it sounds like you're implying.
No, I can't speak to Ms. Gray's intentions at all. All I know about what we're experiencing, and also we should not shy away from the fact that her voting record speaks for herself. She was an obstacle for the removal of monuments in this city for a couple years. So I don't know who or what she might be catering to and whatnot. All I can do is speak to my experience and the experience of my staff, both black and white, who deal with this vitriol each and every day. You're going to have to ask Ms. Gray about her intentions.
One more question, let's wrap it up.
Yes, COVID.
Who will this be available to, just RPS students or any children? And also, how long will that survey be open?
It will be open to kids here, families here in Richmond. We want to hear from every family as we can. How long will it be open?
Until we get a picture that's reflective of our community.
Till we get enough responses that allow us to be reflective of the community.
Okay.
One right here.
Question for Dr.
Dr. Avula?
There's a resolution for the General Assembly's special session encouraging hydroxychloroquine being used to treat COVID. I was curious your opinion as to whether you think that's necessary or if it would be helpful.
The question is that there's currently a resolution before the General Assembly raising the question of should hydroxychloroquine be used as a treatment for COVID-19. I think that the data has not been particularly compelling around hydroxychloroquine, and I would say that there's really no need for states to make individual decisions about that. I think the scientific data should show whether hydroxychloroquine is effective, and then healthcare providers can decide whether they should use that in their treatment plans.
Any more COVID questions? Any questions in general? We're good? Everyone stay safe and stay strong. Thank you very much.